Since early 2019, Survivors of Torture Services in Louisville has been a part of the Family Health Centers. And we are located at the site of Americana Community Centers and Family Health Centers Americana. Family Health Centers has been in existence since 1976 and is a not-for-profit community health organization that provides a variety of health services and preventative services regardless of the patient's ability to pay or regardless of insurance. It's very patient-centered, it's comprehensive and coordinated, so it's a perfect fit for our services. It's allowed us to be more comprehensive than we even were before, because now we are able to collaborate with the patient's medical providers. So I'm going to talk for a few minutes about more of the impact of torture on survivors, and then talk about what our program in Louisville does and how you can make referrals. As Dr. Starr mentioned, torture has very comprehensive effects on individuals and communities. It has many impacts on a person's physical health, and it's helpful for medical providers especially to keep in mind that because of, or depending on the types of torture that someone has experienced, the person may have hearing loss. Often they have digestive issues and phalanga that Dr. Starr mentioned. They often have foot pain and numbness on the bottom of their feet. Insomnia and nightmares is one of the most common symptoms of torture survivors. Fatigue, which is deep-seated and very hard to overcome. Dental pain, vision problems, sexual difficulties. Many have musculoskeletal pain, and that can be have physiological roots. At times they also have somatization, so maybe they have pain and you can't find what the root of the pain is. And so it's helpful to have close coordination between medical providers and mental health providers, just so that you can rule out physiological reasons and determine what the root of the pain may be. Many of them have scars and physical pain from those scars. And headaches is another very, very common symptom. And then psychological symptoms, that these run deep and can go on, but this slide and the next one touch on the ones that are the most common and the ones we see in our practice. Pervasive fear and mistrust is at the top of the list. I'm not sure I've worked with one single patient in the 7 years I've been doing this that doesn't have a level of fear that impacts all the aspects of their life. And it makes it very, very difficult for them to trust anyone. It often takes a good bit of time to develop a therapeutic relationship with them. And even once that's established, it takes years for them to get to the point where they can begin to trust the people around them in their community. Shame and humiliation is very common. That's one of the aims of torture, is to leave people feeling humiliated. And that's also very difficult to overcome with treatment and therapy and the gradual building of trust. A deep sense of anguish. So in addition to the post-traumatic stress disorder that Dr. Sarr talked about, there's often a sense of pain that's beyond anything most of us can even understand or have ever experienced. We mentioned fatigue under physiological symptoms, and mental fatigue goes along with that as well. When the brain is so busy trying to survive, and sort of operating as if the horrible things that happened in the past are going to happen again at any minute, it leaves a person feeling very, very exhausted and without really much energy left to do anything that they need to do in terms of problem solving in their daily lives and thinking and learning, which leads into the significant impact that torture has on someone's mental capacities, their ability to think and learn and focus. So many of them are often left feeling disoriented. I work with people who can't really go for walks outside of their neighborhood or even their street because they often find themselves getting completely turned around and disoriented. And part of that is a function of the intrusive memories and sometimes the flashbacks that can hit at any moment and leave them unsure of whether they're in the present or the past. Many of our clients, most of our clients, have more difficulty than the average immigrant learning the English language because it's so difficult for them to focus. And many of them have difficulty with short-term memory across the board. And then the last of the major psychological symptoms are a sense of disempowerment and just feeling completely helpless. And as we spend a few minutes going into what we can do to help, one of the things to keep in mind is anything that we can do in any setting to help them feel a sense of choice and a sense of power and control can begin to pull them out of that sense that they can do nothing to affect the outcome of their lives. So in your setting and in our settings, there are many, many things we can do to begin to create a safe environment. And this list bears often helpful to go back to the list of physiological and particularly psychological impacts of torture, and then ask yourself the question, what can I do in my environment? What can I do in my waiting area or in my office or at the door where we welcome patients in to help them feel safe and welcome and comfortable? Number one is to ask them what they need. I always try to begin my initial session with a new patient by telling them that our number one goal is to help them feel safe and comfortable, and asking them what they need and encouraging them that if they begin to feel uncomfortable, that they let me know. If they need a break, they let me know. If they need a different seat because their back is hurting, let me know. It's important to keep in mind that many of our patients, because of the torture they experienced, begin to feel panicky when they're in confined spaces. So as we bring them into our offices, many of which are small, to keep in mind that they might need to sit near the door to feel safer. They might feel more comfortable with the door open than the door closed, and some vice versa. So again, asking them and letting them let us know what they need in order to feel safe. it's critical to remind and remind again of the fact that we will respect their need for privacy and their confidentiality. And it often helps them even more to hear that from the interpreter than from us, because they're more afraid of someone taking what they share back into their community. So much reassurance is needed in that area. We've talked about providing choices and opportunities for them to feel in control. It's a few things to avoid. Avoid reacting in shock or horror when they share something horrific that happened to them. And that does not mean that it's not okay to let them know how concerned you are or how empathetic you are, but reacting in horror can give them the indication that you can't handle what they're telling you, and they need to know that you can handle all of it, while they let out things that they may not have shared ever. It's important to try to avoid saying "I understand," which is a statement that's common for many of us when we want to let someone know we're listening and we're attempting to understand. But in the case of torture, we will never understand. And so what they need to hear is that I'm here with you now. And what happened to you should never happen to any human being. And we will get through this together. Often, because in the case of torture, multiple episodes of torture often, what came at them was completely unexpected. And if they were in prison for periods of time, they had no idea from 1 minute to the next what might happen. So the more we can be transparent and the more we can let them know during their time with us, this is exactly what you can expect will happen. First, there'll be a little bit of time waiting, maybe 5 minutes, and we'll give you some tea or coffee. And then you'll come back to my office where we will get to know each other more. And I might ask you some questions. If I ask you any questions that are uncomfortable, you can let me know. You're not obligated to answer anything that you don't want to answer. Let them know why we're taking notes, why we need to know the particular information we're asking. All of that reduces their level of anxiety and gives them more of a sense of being in control. And of course, speaking in a calm voice and making calm movements. Often a quick movement or standing up too quickly can be a trigger for someone. And then avoiding confrontation. I mean, all of us want to do that in any setting, but particularly with people who have survived torture, that can be extremely threatening. We won't go through all of these, but be mindful in your environment of things that can serve as triggers to survivors of torture. In the medical environment, things like needles and drills and being confined in like when they're having an MRI or something can be extremely triggering. Loud noises and alarms and sirens in general. Touching without permission. It's often helpful, especially in a setting where you may be in close proximity. Hug is appropriate to ask permission before you do that, before you reach out and touch, because that can be a major trigger for many people. Crowds is something we might think of in terms of a crowd of 200 people, but in a crowd in a torture survivor's world may be 5 people. And so as you're planning where people will wait when they come in, or how many other people will be in the room with them, it's really important to think in terms of what may have happened to them and what they may need. So in our setting, we often, if we're aware of someone having issues being around too many people, we may offer them the option to sit in an empty office while other people are in the waiting area, so that they don't get triggered by the feeling of being crowded by too many people. The feeling of being interrogated can be a major trigger. And often in our lines of work, that's part of what we do. We have a list of questions and a lot of information we have to pull from people, and sometimes in a short amount of time. And we need to be very mindful of how we do that, and that we do it in a way where we're asking open-ended questions as much as possible, where we're, like we said a minute ago, where we're letting them know why we need this information, and even sometimes apologizing for having to collect some of the information, so that it's a kind and respectful process. So at our center in Louisville, and I would venture to say in most settings where they're providing services to survivors of torture, some of the core treatment methods that we use are, number one, witnessing. We sit with them. We let them cry and share, and sometimes recount horrible details of what happened to them. And rather than try to fix it, we're simply present with them. And we have some patients who come in who, that's in their minds, once someone witnesses the horrors of what happened to them, that's all they need. We have had some Bhutanese patients in the past who come in, and we give them plenty of time in their first appointment. And at the end of that time, I've had several Bhutanese patients say to me, "Thank you so much. That this is what I needed," and then proceed as if we're finished, that their treatment is over. They've done what they needed to do. And in some cases that is the truth. In other cases, we continue to work with them. We do a lot of psychoeducation, teaching them why their bodies and their brains are responding the way they are, teaching them about the fear response that is common to all human beings and animals, and teaching them the symptoms that go along with having post-traumatic stress disorder or depression or anxiety or a combination. We do a lot of work helping them to sort of rediscover the things they have, the strengths they have in themselves, that have allowed them to get this far, and that will allow them to continue to grow and heal. We do a lot of work around helping them to regulate their emotions, because because of the fear response, often they're reacting as if everything is a threat. And so helping them begin to experience the world in a different way, where they can calm themselves, and then eventually recognize that the world is not as dangerous of a place as their body and their brains believe. We do a lot of work around the connection between the mind and the body and the emotions, and a lot of times that's very disjointed and disconnected for people, and we help them sort of bring themselves back, bring all of that back together again. And then in some cases, but not in all, we're able to get to the point where we're able to sort of go back and revisit the trauma and help them work through that and process that, so that the beliefs, that their core beliefs that changed, can begin to be readjusted so that they can face the world in a more healthy way. There are other times we never push people to do that, to go back and revisit the trauma, and there are many times when they're never ready to do that. And so we focus more on the other treatment modalities. Dr. Someone to be served in our program. And basically, as long as they meet the US definition of torture, or they're a secondary survivor, meaning they have a family member who has experienced torture or they've witnessed torture, then we can work with them. And I have my contact information up here, our office number. So if you have any patients that you believe that live in the Louisville area or surrounding, and you believe might be appropriate for us, you can give us a call. We do have a brief 2-page referral form, and we can talk through that with you. We can email that to you if you need it, or fax it to you. But we're more than glad to talk with you if you have someone that you think might be appropriate for our services. And finally, I included a slide that has a couple of additional resources. As you can imagine, I barely touched the surface of what all is available in terms of working with survivors of torture, but these are 2 really good websites you can visit to get additional information. And we so appreciate your interest in this topic and your willingness in your own work setting to try to make the encounters that you have with survivors of torture to be healing encounters.